In the intense world of medical emergencies,
one patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, 2 lives are in danger after a double stabbing.
Life-threatening, potentially life-changing.
His ankle is off by his head.
A pedestrian is run over by a bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Matthew, open your eyes.
A driver collapses after a high-speed crash.
He's just not responding to pain. We're going to put him to sleep.
Can you hear it going on?
And a man is left battling for life after a city centre fight.
(7062).
7062, good morning.
7062, good morning. I'm here. You can book me on here all day.
It's the start of a 12-hour shift for critical care paramedic Jack Lewis.
I am relatively apprehensive about what we're going to get today. I was on the trauma desk yesterday, very, very busy. This car particularly, with a range of stuff from quite nasty trauma to some unfortunate medical incidents. I think we're going to be the same today.
Ambulance service, is the patient breathing?
He's just been stabbed.
Okay, what have they been stabbed with, do you know?
A knife.
Okay, are they bleeding heavily?
Yes.
And how old are they?
The lad.
Do you know where the stab wounds are?
One's got 1 in the stomach, one's in the chest, and one's in the stomach. The one that's got 2 stab wounds is losing consciousness.
Are you if he's lost about 2 mugfuls of blood?
It's close to.
Okay.
Can you just send an ambulance,
Yeah,
please?
it's not delaying any help, sir, okay.
62 Whiskey Romeo.
A stabbing is one of the most challenging situations a critical care specialist can face. If an artery has been severed, a patient can bleed to death in minutes.
Been deployed to reports of a double stabbing, 2 patients, one with chest injuries, one with chest and abdominal injuries in a park not too far from the QE, so hopefully it'll be a case of a rapid assessment, major hemorrhage or like, you know, life threat control, and then a rapid education. 60, thank you. ETA approximately 3 to 4 minutes.
The critical care team in the West Midlands deal with more than 30 stabbings every week. Reducing the number of deaths is one of the service's main objectives.
Police en route. So you'll be first on scene.
Roger, that's all copied.
We are having updates on scene of these patients are unconscious. Please, 50 days, ETA was 2 minutes.
Roger, given the severity of their potential condition, I am happy to make scene with a dynamic risk assessment received.
With 2 patients' lives on the line, every second counts.
A data report from police has come through that they're both unconscious, so potentially this is going to be 2 traumatic cardiac arrests.
7062, receive over.
60, that's all copy, just pulling up behind 4634, that's Romeo 55 now.
On arrival, it's a major incident, with multiple police and ambulance teams already at the address.
Hi, Rob. Yeah. Roger.
2 neighbours have been attacked. Simon, who's outside, was stabbed while trying to defend his friend. 41-year-old Matthew, who has collapsed in the stairwell, has been stabbed twice.
Come on, breathe. Go on, deep breath out. Come on, you can. Okay.
He is struggling for breath. The stab wounds are close to his lungs, and they are in danger of collapse.
They put Kettle on, I've not looked at wounds.
That's fine. Is he on O2? Hi, mate.
He's on O2 from police, not ours.
The wounds have been sealed, but with internal bleeding and potential organ damage, he's at high risk of going into cardiac arrest.
GCS 15, chest seal applied, oxygen on, and we're just going to get him gone and gone. He's got a good chest wound and a good abdominal wound.
All right, we'll put him straight on 463
Yep.
the crew are with him. The second crew, I haven't seen this guy's wound yet, but it's abdominal.
I'll have a quick
so I'm going to get this crew to
cheeky
bring
look.
their stretcher up, and we'll get this guy's.
If we just load it both and just get them all just gone straight off. I'm just going to grab an apron because I'm half PPE'd.
Once in protective PPE, Jack can make a close assessment of the other victim.
Rob, whilst they're dealing with him, I'll just have another look through this guy.
54-year-old Simon has one small but potentially deadly incision.
All right, can I have a little look, sir?
Oh. You okay, mate? Just you okay? You okay?
Okay, good.
You're right.
Okay, it's a bit of bowel, but
You okay?
it looks little. It looks like there's too much there with lots of vein through it. Essentially, that is bowel, but
The stab wound has gone so deep, his bowel is now protruding out of his abdomen.
You okay, mate? Just you okay? You okay?
Okay,
You're
good.
right. You're right.
If his bowel has been cut, he's in grave danger of sepsis, which can lead to organ failure.
So, hello, sir. My name's Jack, okay?
Oh, yeah.
Do you have any pain anywhere else? Have you been hurt anywhere else?
Yes.
Can we get this bag off you? Is that all right? Are you happy? I'm going to get this top off you, mate, okay? Just to check and make sure you've been stabbed anywhere else, all right? Okay, let's have a look in your arms. Nothing in the back. You definitely weren't stabbed anywhere else? No, there's no obviously bleeding, there's nothing into the wounds. Fine. Okay, good.
You all right?
Yes, happy for this gentleman on your stretcher. Is that the plan, Rob?
Let's get him, because the sooner he's moved, we
Yeah, let's go.
Suddenly, a fight breaks out amongst the bystanders, threatening not just the care of the patients, but the safety of Jack and the ambulance crew.
Ambulance service, is the patient breathing?
I don't know, love. I think he's underneath the bus.
Someone's been run over.
Yeah? Is the fire engine coming as well? Because they might have to lift the bus up.
Yes, I have requested for fire as well. Hello, I'm actually a nurse. I spoke to the gentleman under the bus. He said he can breathe. However, his arms are trapped. He can't free his arms to get from underneath the bus. Okay. We are coming to you on a blue light response and we'll be with you as soon as possible.
With a man run over by a 12-ton bus, the risk of catastrophic injuries is huge. So critical care paramedic Colin Apps is immediately dispatched.
The colleague, just so you're aware, so he's coming through as one patient. Man is still conscious, but still trapped underneath the bus. You have got a crew in attendance, and OM is about to book in as well, over.
That's all copy, thank you. We're about 8 minutes away at the moment. Helicopter, helimed is going as well.
He's not trapped under the bus. His ankle is not
Sounds like he's going to have some injuries, doesn't he?
The incident is so serious, the air ambulance has also been scrambled.
Sometimes this is really quiet and since there's very little space to get much into the bus, the bus is recommended for this additional.
12 minutes after receiving the call, Colin arrives and is briefed by the operations manager overseeing the incident.
He's just been trapped underneath this bus here. Yeah. His ankles were literally by his head.
Yeah.
This is as tight as you could get the boss.
Okay.
And we've literally just had to drag him out. Literally pulled
Yes.
him in half under.
GCS 15 still? But...
GCS 15, yeah.
And you don't think he looks very well?
Hill and climbing from what we could see. We couldn't get any oxygen. We literally just got him out.
Thankfully, just before Colin arrived, firefighters were able to free the man, and he's now being assessed by paramedics.
Has he said he's got any pain anywhere?
In his arm.
Where's your pain?
Andrew, relax this one.
Guys, take his clothes off completely. Get full monitoring on him. We need an ECG on him so we can monitor his accurate heart rate.
Yeah.
All right?
We've got a blood pressure ESM.
Yeah, 101 over 69. Good radial as well.
44-year-old Andrew was travelling to meet his wife when he stepped out in front of the bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Although Andrew is conscious, Colin is concerned. If he's broken his pelvis, he could have life-threatening internal bleeding.
So he's got no bleeding under there, but his leg was, you say, quite up above his head, yeah?
By his head, yeah. It's kind of bent over onto this leg was above there.
As a catastrophic internal hemorrhage can cause death within 5 minutes, Andrew's in need of urgent transfer to a major trauma centre.
60, could you just update me? Is HeliMed en route over?
How old are you, sir?
54.
In Birmingham, critical care paramedic Jack is working to save the lives of 2 men who have been stabbed.
So I've got no obs on him other than he's got a good pulse. He's looking a bit pale, as you can see. Single isolated wound.
With 2 patients on his hands, Jack decides Simon is in the most stable condition for the ambulance crew to take over.
I've not taken his trousers off. It looks like there may be some bowel there. There's like a nice vein through part of the flesh, so it could be quite fatty, but I'm not prepared to say it's not bowel.
Yeah, no, sir.
All right.
The other victim, Matthew, is still in the stairwell and in more urgent need of Jack's critical care.
I can travel with either. Probably this chest guy. Probably stick with him because he's going to be the sicker guy.
A bit longer, and if there's anything going to go wrong, it's going to be with him.
Yeah.
Okay.
I'm guarding these for their safekeeping. Please do not say anything. Stay there.
With tensions running high, police officers make a cordon to shield the paramedics from harm.
You guys have to get him on, and I'm going to start drawing out some TXA. Stand by. Life-threatening.
Life-threatening, okay.
Potentially life-changing. Yeah, you get him gone, get him gone.
Get him onto the truck, yeah?
I'll meet you there. Yeah.
So the dog ambulance can take you down to the ambulance.
It's vital Matthew is kept as calm as possible. With 2 deep stab wounds, any rise in blood pressure will increase the speed of blood loss and he could go into cardiac arrest. With a police dog escort as protection, Matthew is quickly evacuated to the safety of the ambulance.
Let him go now.
Yeah, I know, yeah. Try and get these doors. Yeah, I'm going to get them.
6-2, go ahead. Very disordered scene. Can you pull yourself forward, mate, with my help? Matty, give us a hand. Now push yourself as far back as you can and get yourself sat up nice and high for me. Get your legs planted in, you've got good movement. You're doing really well. I know this is a really distressing time, but we're going to get you through it, all right?
Once on board, Jack gives Matthew a vital injection of tranexamic acid to try and stem the blood loss before updating the trauma desk.
I can't breathe.
So I have got a 41-year-old male. We've got 2 wounds. Okay, 1 non-sucking chest wound to the right anterior and 1 wound to the right lower quadrant.
They will alert the hospital to expect 2 critically injured patients who will need urgent surgery.
He's had TXA oxygen applied. The other patient is on the other vehicle. He has an abdominal wound, potentially a spat of small bowel visible. We are leaving scene now for the QE. ETA approximately 6 minutes.
While travelling on blue lights, Jack closely monitors critically ill Matthew.
Is that pain a bit better? Yeah? Feel a bit easier? Good. You able to take a deep breath in for me? And now, sore on that side? It's all right, I know, I just need this chassis to stick a bit. Otherwise it's not doing a huge amount. I don't think you damage your heart, I think it's your lung, essentially, or the space where your lung should be, okay? When the call came in saying we had 2 patients both stabbed, potentially both unconscious, I'm thinking traumatic cardiac arrest, I'm going to have to really prioritise who's going to get my help first. Yeah, just twice. The trick with these patients is get going while the going's good and don't waste time. We're not going to fix their problems on scene. If they arrest on scene, we're in a whole world of trouble.
30 minutes after the emergency call was made, both stab victims are handed over to the major trauma team at the Queen Elizabeth Hospital, Birmingham.
Either of those wounds could potentially kill someone. The gentleman that I was with, he had air in his chest that was taking up space that lungs should have been taking up, so compromising his ventilation. The other gentleman, if he's nicked his bowel, that can be really quite complicated. Both are going to be at least life-changing and going to require significant recovery.
You got pain here? Pain there?
In Dudley, critical care paramedic Colin is dealing with a major incident at a bus station.
Do you take any medicine for anything, don't you?
Epilepsy.
Epilepsy? OK. You haven't had a fit at all, do you know of?
No.
Andrew stepped out in front of a bus and was trapped under it for more than 20 minutes.
We'll get morphine on the truck if you guys are up there. Yeah.
You would just give us the IV paracetamol for now.
Paracetamol going in, guys.
Andrew, you still here?
Yeah.
Good man.
Colin is concerned he may have life-threatening internal injuries.
Can we grab another crew?
Andrew, where does it hurt?
Just sat down, just feeling pretty shaky. And his shoulder. In your shoulder is
So is it you had the TXA, or was that just being drawn up, yeah?
Colin gives Andrew tranexamic acid to help stop excessive bleeding.
Just chuck it over this side, I'll pop it on this side.
Although they've managed to stabilise Andrew, they need to get him to hospital fast.
7062, what's Helimed's ETA now over?
Colin checks the whereabouts of the helicopter.
What do you think about leaving scene to the QE? And we'll just, because I don't think Helimed's going to do anything extra now.
No, it's beeping 91 over 6.
It's come up a little bit, so don't worry about the fluids for now. We'll do it on the way.
Rather than wait for the air ambulance, Colin and the crew decide it would be best if he escorts Andrew to hospital by road.
Nice one. Thanks, guys. See you later.
A patient with internal injuries can suddenly deteriorate, so Colin's critical care continues throughout the 20-minute journey.
How's your pain now? Does it hurt anywhere? What happened? Do you remember?
At the Queen Elizabeth Hospital in Birmingham, Colin hands Andrew into the care of the emergency doctors.
Okay.
All right, Andrew. She's at the hospital now. All right.
Quite a serious job, especially in terms of the mechanism and potential a serious injury. I suspect he's injured something, I'm not sure what, which is why he's having a CT scan so he can find out. In terms of his observations, he didn't seem terrible, but I'm sure he's got something wrong with him.
As night falls, there is no let-up for the critical care teams.
So just have a check that there's nothing that's out of date.
At base, Dr. Ravi Chauhan and critical care paramedic Richard Apps have just checked in for their night shift.
It's not going to be a normal hot Friday weekend, and I think that's just because of what's happening with COVID, with lockdown and social distancing. But I suspect today will be probably quiet to begin with, and then maybe some RTCs.
I think you're being very optimistic that people are still behaving with lockdown. I don't think they've behaved for weeks. They've all gone mad. The job numbers are all back to stupid again now.
It's not long before Richard is sadly proved right.
Ambulance service, patient breathing.
I don't know, there's been a fight. He says cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear it going on?
Yeah, okay, so male adult.
Male adult by the looks of it, yeah.
Okay, and you said that he seems unconscious.
He's had cold blood.
Have you got any idea what's happened at all?
Looked like it was a fight. It all happened really quick, and then all you heard was this crack. And I'm reckoning his head on the tile floors. He's bleeding. Or he's being sick. Whatever it is, it's not looking good. Can you hurry up with the ambulance, please? They're doing CPR. They're doing CPR on here.
They're doing CPR, okay. We are coming as quick as we can on blue lights.
An ambulance has been dispatched, but the man's injuries are so severe he may be in cardiac arrest and in need of enhanced critical care from Ravi and Richard.
We are going to central Birmingham to reports of an unconscious patient following an assault.
Hi, thanks. Just a quick update from the scene. There's a crew in attendance. The patient you're going to has a GCS of 3. He was hit over the head with something. He has finished pupils, trismus. They report the scene as being very chaotic. They're scooping the patient and loading him onto the back of the ambulance. They're going to try and get bilateralised the access ready for you.
Yeah, that's received. If they are having airway issues, I would suggest that they go to nearest whilst we make our way.
Yes, absolutely. They were still on scene when I spoke. I think, from what I heard, you are going to make scene before they're ready to leave. Received.
Yeah, many thanks.
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain and to other organs. So if we're struggling with that, then we may have to act pretty swiftly. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
I haven't seen the vent or anything. Just sort of pushing through these checks in case we get an early job.
It's 7 p.m. and Dr. Polly Haywood is getting ready to start a Saturday night shift.
It's payday this weekend, so we could expect it to be busy, but obviously we don't know if people are not socialising as much as they might do with coronavirus.
Tonight, she's paired with full-time critical care paramedic Sarah Foley.
Yeah, that's the third one. Have you checked it's got enough masks and stuff in, or...?
No, the blue kit.
No, I'll have a look.
So this is a brand new car, so we're just kind of familiarising ourselves with it. We've got burns kit, maternity kit, including the slightly unlikely nerve agent protection. We've got snow socks. I hope we don't need those.
Don't think so.
Ambulance service, is the patient breathing?
Yes.
Are they conscious, awake?
No.
He's not responding to you?
He's not responding, no.
If you gently shake his shoulder, does he wake up in any way?
May, can you wake up for me? May, can you wake up for me? No, he's not.
Okay.
He's been in a car crash, and a fairly big one. By the looks of it, he's lost control and is driven into a lamppost and then a tree.
Okay.
He was up and around for sort of 5 minutes. He lay down and then he sort of passed out. So.
Okay. We are coming to him on blue lights.
A man suddenly collapsing after a high-speed road collision is a Category 1 emergency. An ambulance has been dispatched, but critical care backup from Polly and Sarah is also needed.
The patient has driven into a lamppost, then a tree. Only him involved. Patient was walking around after the RTC, then lay down. When you crash into motorway furniture or lampposts, they're all designed to deform. A tree is not designed to deform.
With over 1,700 deaths on Britain's roads every year, the team have to be prepared for the worst.
Hi guys, high speed RTC, still GTS 3. He's got some confusion to his head that might possibly be isolated head by the sound of it. Blood pressure 134 over 82. Maximum respiratory effort. We're quite busy on feed.
That's absolutely fine. Just keep us updated before they leave the scene. It sounds like patient would require an RSI.
Sarah and Dr. Polly are highly qualified to perform an RSI or roadside anaesthesia should it be needed.
Is there enough space in here? Yeah, I think there is, yeah.
When they arrive, the injured man has been moved to the ambulance.
Right, we're both going to have to do level 3, aren't we?
As Polly and Sarah may need to put a breathing tube down into the man's lungs, they both must wear the highest level of protection against coronavirus.
So it's a really fine mechanism. It's a little bit weird. Some people quite adequate, to be fair.
While they dress, the paramedic updates them.
And he's come out of the car. He's been walking around for about 5 minutes apparently.
Yep.
Witnessed by bystanders.
Yep.
And he's just collapsed. So he's been GCS at 3 with us.
A GCS, or Glasgow Coma Scale assessment of 3, is the lowest level of consciousness and a sign of possible brain trauma.
Hello, buddy.
Now in COVID protective suits, Dr. Polly and Sarah begin their close assessment of the patient.
My name's Dr. Hayward. I'm one of the merit team. I'm just having a feel across your chest wall, sweetheart, OK? He's got like a laceration there.
Yeah. So anything to suggest that he's under the influence of anything? What's that?
Bit of a lack there, like a seatbelt lack. He's got a very firm belly, but all his numbers are normal.
Completely perplexed.
Although the man is unresponsive, his vital signs are good.
What's his name?
Matthew.
Matthew, have you taken something? Hold your arms up for me, buddy. Hold your arms up. See, there's tone in there. Hold your arms up. OK, hold it up there for me, buddy.
To assess Matthew's brain function, Polly checks his arm reflex.
This is all very odd, isn't it?
Yeah.
If he's unconscious, his arm should fall totally limp without any reflex. But as she drops it, Polly can feel the muscle tense, which is very unusual for someone unaware of what's happening.
So it seemed to walk at scene, but then...
Yeah, he got out of the car for about 10 minutes, was complaining about pain in his back, was fixated about finding his phone, and then by all accounts he sort of sat down on the edge of the road and then collapsed and was in this state from that point.
It's a mystery Polly needs to solve fast. Time could be running out for Matthew.
Let me just have a listen to his chest. There's nothing here on his numbers that makes me want to put him to sleep.
Dr. Ravi and critical care paramedic Richard have been dispatched to Birmingham city centre, where a man has been seriously injured after a fight. He's now on an ambulance. The crew brief Ravi.
What's going on?
This is Julian Griswold, assaulted in the head.
Yeah.
I'll step up with GCS 3.
Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
His right ear, he's got 2 amounts of congealed blood. Pupils, left side sluggish in 3s, right side was reactive in 3s.
Julian is completely unresponsive and bleeding from his ear. All the indications are he has suffered a traumatic brain injury.
His trismus, we couldn't get an APA in, so we popped an MPA in on the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access, He's been blood pressure stable throughout, and we've given him 1 gram TXA.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. As the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation is stable, and have anaesthetics on standby. We're not going to RSI here, but you'll probably need us. Okay, cool. All right, so that's bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, you know, we won't really know what his outcome's going to be.
In Oldbury, critical care paramedic Jack Lewis is making a mid-shift pit stop.
Never know how it's going to pan out doing this type of work. Could well get 1 or 2 more jobs before the end of the shift, but in case we don't, it's about kind of preparing, taking the opportunity while we can to get the car ready for whoever's on tomorrow, who might be rushed first, you know, out first thing. So we've still got a couple of hours left for things to happen.
Ambulance service. Is the patient breathing?
No, I don't know. An old man's just dropped and collapsed on the floor. Near his head. Heavily bleeding from the head.
Is he making a grunting or is
Yeah, definitely.
Okay, is he awake?
Hello? Hi. No, you're not awake.
No response. We've got the help on the way for him, okay?
Please go 2144, please go through the Cat 1, unconscious, noisy breathing. ETA is about 10 minutes. Proceed.
Roger, all copy, no worries. I'll give you an early update. Thanks. ETA approximately 3 minutes.
A man who has suddenly collapsed and reportedly unconscious is part of the reason the critical care team was set up.
We're about a minute out. We'll probably be first on scene. There's a crew also en route, but they're probably about 8 minutes behind us.
They are highly trained, able to administer life-saving treatments at the roadsides over and above regular ambulance teams.
Male in his 70s, unconscious, sounds like a collapse. Patient collapse, hit head. Hi guys. Hello, my name's Jack from the air ambulance. How are you? What's your name? Tony. Do you know what's happened, Tony?
Tony, a retired engineer, was on his way to his local shops when he fell and hit his head on the pavement.
Do you remember what's happened at all? No, you've banged your head, you've given yourself quite a clock, I think. Yeah, have you got any pain anywhere? Nothing at all? OK. So you don't remember what's happened, you've been seen to walk down the street and you've gone down and you've clocked your head. I can see you've got a nasty wound to your head there. Do you think we can try and roll you onto your back, sir?
I've got some shopping to do.
That's OK, we can do that a little bit later. Let's make sure you're well first. OK. Can I give you a bit of a check over, Tony?
Yeah.
Although Tony has regained consciousness, he has no recollection of what's happened.
How old are you, sir? Give me a rough idea. 64. And do you suffer with any medical problems?
Nothing.
Nothing at all? Do you take any
He's also very confused. Tony is 75 years old, not 64.
I'll sit up next to you, it's whatever you'd rather. Do you think we can get this jacket off? I think you're probably a bit warm.
It's 27 degrees, and Tony is dressed for winter. Overheating may be one reason for his collapse.
Let me come behind you. Sit up for me. Good, ma'am. Tony, can we get this jacket off? Give you a bit of a check over. Have you had much to do? Any food, lunch today? Anything to eat? No. Much water? No.
Jack needs to be sure there aren't any other underlying causes, particularly seeing he already has another recent head injury.
Do you take any medicine to thin your blood? No. OK.
Tony's displaying some concerning symptoms.
Do you take any medicine for anything at all? Nothing. OK.
His sudden fall, difficulty speaking clearly, and confusion could all be signs of a stroke.
Very flat, isn't it?
In Shrewsbury, Dr. Polly and critical care paramedic Sarah are dealing with a puzzling case.
Buddy, come on, matey.
Matthew has had a high-impact car crash and appears to be deeply unconscious. But Polly thinks he may have some awareness, and for an unknown reason, can't move or respond to her.
Inside of the vehicle.
Have we got big intrusion? He has got a shift there, isn't he, into the centre console?
Into the back and there.
To try and establish what might be causing Matthew's paralysis, she looks at photos of the crash to see if she can glean any clues.
By all accounts, he was into a lamppost, then onto a tree.
So with those scene photos, we need to go to major trauma centre. The options are we tube him, or we take him straight and we tube him if necessary. His numbers are perfect. He looks good. He had voluntary swallow. Been watching him swallow.
Just not wanting to respond to it, is it?
No.
Having examined the scene, Polly suspects Matthew has internal injuries. She tries one last time to wake him. She gives his skin a sharp pinch to see if he has any response to pain.
I think on paper we are GCS3. I have given a really big painful stimulus.
Big mechanism.
Big mechanism of injury. He's got voluntary eyelash reflex. He's got some swallow. Yeah. But I've given a very painful stimulus and no dice. Right, we'll go to Stoke, walk us into sleep.
I'll just tell the OM exactly what we're doing on our setup. Hi, you all right? So it's a long journey to Stoke. We're going to put him to sleep. There's something doesn't add up here. He's just not responding to pain.
We do the RSI here then, are we?
Yes, okay, yeah. Is that all right?
Concerned Matthew may have a brain injury that could have life-changing consequences, Polly decides to put him into an induced coma to reduce swelling in the brain, protecting it from further damage.
Our journey time up to Stoke is about 35 to 40 minutes, so we're just going to quickly pop him to sleep for the journey, and then he can go straight into a CT scanner to assess him for his injuries. Although we can't physically see any injuries on him at the moment, he's not waking up.
Matthew! Matthew! I'm having a look at his airway. He's got a smallish chin, but that looks pretty reasonable.
There is always a risk putting a patient into a coma, but doing it on an ambulance, 35 miles from the nearest trauma centre, the stakes are so much higher.
We'll optimise our airway position.
So the ventilator's working. I'm going to turn it off for now.
And what have we got there? Ket, rock, a bag of fluid for flushes.
So I think we're pretty much there now.
The checks are done, drugs drawn up, Polly is ready to anaesthetise.
Oh, hello. Oh. All right, buddy. That's about on time.
When Matthew suddenly comes round.
Matthew, open your eyes. Hello, buddy. You're on the back of an ambulance, sir. Matt, open those eyes for me again. So we've had voluntary eye opening, that's great. Obeying commands, 9. Can you talk to me, buddy? My name's Dr. Hayward. We're near Shrewsbury, fella. You've been in an accident. Hi, Matt. I know we're dressed up like out of something like out of ET, all right, but you have had a period of being unconscious. Do you know where you are? No. So I think what we'll do is we're all ready to go. If we give you a nod, we can RSI on the way. There's no indications for this patient's asleep.
As Matthew is now conscious and responding to Polly, the anaesthesia is aborted.
Have you got pain anywhere?
Everywhere.
Everywhere? Where hurts, fella?
My neck.
Your back and your neck. OK, sweetheart. So if you can bring that neck a little bit straighter, we're going to just tape you here to keep your neck nice and still, buddy, OK? Have you got pain in this tummy? Are you OK? Or is it in your back? Belly in your back. All right, sweetheart. Right, let's just leave sooner rather than later.
Matthew may have spinal damage. He needs an urgent CT scan to check for any fractures in his vertebrae which could cause paralysis.
We have a 28-year-old male who was a driver of a car, high speed, impact into a lamppost and a tree.
Sarah updates the trauma desk on Matt's condition and to alert the hospital of their arrival.
Was a GCS of 3, but still had eyelid reflexes in the way of blinking when you touched his eyelids, but there was no response to pain.
Dr. Polly continuously monitors Matthew during the journey to Stoke.
Thank you.
Got it. OK.
All good, yeah, thank you.
OK, just monitor.
50 minutes later, the critical care team can finally hand Matt over to the waiting trauma doctors.
Blood pressure's good. You are quite tacky. I think you're probably quite dehydrated.
Critical care paramedic Jack Lewis is treating 75-year-old local resident Tony after he collapsed unconscious in the street.
Have a little bit of water for me.
He has a nasty head wound and may have a bleed to his brain or suffered a stroke.
This is Tony. So Tony's fairly regular fixture around here.
An ambulance crew has arrived to take him to hospital. Jack briefs them on his initial assessment.
He's walked down the street a bit unsteady, held onto that and then collapsed, fell to the pavement, hit his head, as you can see, with a brief period of LOC. On my arrival, GCS 14, sat himself up, no obvious neck pain, not complaining of pain anywhere else. Wound here, not actively bleeding, a bit boggy and a bit kind of angulated.
Right then, Tony.
We'll get you on a stretcher, Tony.
You on our stretcher? Legs together, that's it.
Ready to push? 1, 2, 3. Good man.
Tony needs an urgent scan and full investigation into the underlying cause of his collapse.
I'll pop you up to Russell's Hall to get your head looked at. Why? Because you've cut your head.
That's 3 or 4 days now.
It's not. You've done it today. You've got a nasty bump as well.
Not today.
All the blood on the pavement says otherwise.
Jack knows there could be many reasons for Tony's confusion. Heat exhaustion, dehydration, or something more life-changing.
GCS 14 initially.
You don't remember falling at all?
Not today.
No. Okay. Even more reason to pop up the hospital then. You need to get that looked at.
After updating the trauma desk on his assessment, Jack has done all he can for Tony at the scene.
Take care, Tony. Feel better soon, sir. OK.
And hands him into the care of the ambulance crew for the journey to hospital.
Better.
Fern Britton takes us round her favourite place on earth and gets back to her pagan roots in brand new My Cornwall tomorrow night at 8. Can't wait. Next tonight we're in A&E where the medics have to work fast to save the victim of a machete attack in 999 critical condition.